While I don't have detailed case numbers today, I can tell you that about 800 new cases have been identified in the last 24 hours. Currently, 9 hospitals across the province have outbreaks, including a new outbreak declared yesterday at the Chinook Regional Hospital. AHS is working hard to limit the spread and safely manage all outbreaks to protect residents and staff. It is important to remember that hospitals are still safe. If you need urgent care, do not hesitate to seek it. That said, I am very concerned about the level of hospitalizations for COVID in Edmonton and Calgary. We must protect our health system by reducing community transmission. The fact that we are now reporting 800 new cases is extremely concerning. It is most concerning because it means that the measures that we introduced 10 days ago, which may have helped cases plateau over the last few days, are not having enough of an effect. It means that in about 7 to 10 days from now, our hospital numbers will rise further, which means that care for Albertans with other issues besides COVID will be impacted. One significant concern I have is around the high proportion of active cases being identified who attended work or social events while symptomatic. I do have numbers for current cases up to yesterday, and they are concerning. In Edmonton, 9% of active cases worked while they had symptoms. A further 8% visited retail or service businesses, and 8% attended a social gathering. The data is similar for Calgary, where 11% worked while symptomatic and 9% traveled. Further, 7% attended a social gathering. With more than 2,500 active cases in each city as of yesterday, we are talking about at least 500 people who did not stay home while symptomatic. This is significant. I am calling on Albertans to please stop all activities if you have any symptoms. By leaving your home for any reason other than getting tested or seeking health care, you are putting others at risk and potentially spreading the virus so that one case can lead to many. I know that it is inconvenient and disappointing, and I know that it can create tough choices for some. But it is essential, and I also repeat my request that employers recognize this importance and support their staff to do this wherever possible. It has now been 10 days since we announced new public health measures in Calgary and Edmonton, including the mandatory 15-person limit on social gatherings. I have had many people ask me why we're focusing on social gatherings. The answer is because it is a problem that is driving COVID spread in our communities. By far, the #1 driver of new cases we are seeing is exposure in households and private gatherings. Currently, about 40% of the active cases in Calgary and Edmonton as of yesterday were exposed either in their household or at a private gathering. If we could reduce cases in this area alone, then we would be quickly able to bend the curve back down. The other big area that is concerning is that many of our cases have unknown exposures. In some cases, this is just because the public health investigation has not yet been completed, but in others, there is truly no known source. This is another problem that can only be solved if we work together. By reducing the wait times for booking a test, shortening the wait for test results, and hiring more contact tracers, we will shorten the gap between when a person is exposed and when a contact tracer is able to talk to cases, identify their close contacts, and break the chain of transmission. The shorter this gap is, the easier it becomes to identify exposure sources and reduce the spread of COVID. Unfortunately, as cases have risen rapidly, we are experiencing challenges in our contact tracing teams. AHS does not currently have the capacity to call every contact of every case in a timely way. Effective today as an interim measure until more contact tracers can be hired and trained, AHS will be focusing their contact tracing on high priority settings only. Every confirmed case will still get a phone call from AHS to identify whether or not they have a link to a high priority setting like a continuing care facility, a healthcare setting, or a school. If a case attended a group event like a wedding, a party, or a group fitness class while infectious, or if this could have been the source of their infection, the organizer of these events will still be contacted to ensure attendees are notified. But if cases are not linked to a high priority setting, the case will be provided with information and asked to notify their own contacts of exposures and the need for them to self-isolate and get tested. Resources and information will be made available to these individuals to help them do this. I ask anyone who is notified that they are a close contact, whether by AHS or directly by someone you know, please be compassionate. You are being notified for your own protection and the protection of those around you. Please self-isolate immediately and get tested if you are identified as a close contact. I have said there is no single right way to navigate this pandemic. This remains true, and we must be mindful of protecting each other from the impacts of COVID and the impacts of restrictions. At the same time, I have said that this is a critical juncture. We need to change the trend in this province. Our health system cannot care for the increasing volume of COVID cases without stopping other services, which is happening now. Unless our numbers decline dramatically in the next few days, we will have to consider additional measures to bring COVID numbers down in order to protect our health system.